Hello, everyone. I hope you're doing well tonight. Thank you for joining us. We are going to conduct a live interview with the entire team of MedCompanion. What I'd like to do is show you a quick little video from Marley, one of the founders, and after that, we will commence with our live portion. I do want to remind everybody that this is a webinar style, which means that while you can see all of us, we cannot see you. So you are fully HIPAA protected unless you comment in the chat. If you comment in the chat to ask a question, we'll see your name. So if you prefer to remain anonymous and you have questions tonight, please email Sarah at sarahggpain@gmail.com. So SARAGGPAIN@gmail.com. Okay, so with that, we will go ahead and watch Marley's quick video.
In 2020, my grandmother became sick and unfortunately passed away from metastatic breast cancer. Before going into the hospital, many of us in her family were often confused by the lack of information we were receiving. Most of us were even unaware of her actual diagnoses. She would tell us that everything's okay, but we never really knew what was going on. Even though she was of strong mind, I don't think she truly understood the complexities of her medical care. So this is why we created MedCompanion. Hi, I am Marley Brodsky, founder and CEO of MedCompanion. More and more today, families and friends of patients play an active role in their loved ones' medical care. A lot of times, this means that family members often have to be present during the medical appointments. They need to be in the room to ask the important questions and receive the important answers. Yet, unfortunately, the healthcare landscape forces doctors to have more restrictions and be busier than ever. And with the increased demands on your personal life, sometimes you can't be present. And even if you had the time to follow up with a call, the doctor may not have the time to be on the phone to answer your questions immediately. But now, with our private and secure MedCompanion app, one of our professional MedCompanions can be there for you virtually during your loved one's medical appointment, and they will bridge any gap in communication in their healthcare delivery. When you sign up, we first call you to discuss your family member's medical care, needs, and the questions that you want addressed. During your loved one's appointment, the MedCompanion will virtually attend, listen, document, and advocate on your behalf. Afterwards, a summary will be available within the protected app. In addition, we can also help coordinate future appointments or medical needs for you. My grandmother's story is why the mission of MedCompanion means so much to me. We want to make sure that our team can be there for all of those families who are too burdened or too lost in their loved one's care. For more information, check us out at www.medcompanion.com. And please let us be there for you.
Okay, thank you, Marley. That was such a beautiful video, and we really appreciate you being vulnerable enough to share your, your experiences. It really helps people relate to you and understand why, your team decided to create this company. So, Marley, I would like to introduce you to the entire chronic pain community that happens to be watching today. And while I realized that your video was more geared towards elder care, I'd like to talk to you a little bit, first of all, about how the process works, what it is that you do and how it works. But then I'd also like to talk to you about the ways that this can benefit the chronic pain community, particularly when it comes to workers' comp and SSDI or SSI. So
yeah, absolutely, Gracie. Thank you so much for having me here. I am so appreciative of inviting me to your community. While I can't see you, just know that this means a lot to myself and my team. So just to talk a little bit about MedCompanion, I'll be very honest, just watching that video again, it made me tear up a little, hearing my grandmother's story and just the representation of what she represents, right? And it is all of those patients who go through so much with their health care and are often lost, confused, don't know how to advocate for themselves, and sometimes just can't afford to have someone there with them, whether it's because they're working, they're mothers and can't find childcare, or they have children who are professionals and they're busy in their lives, or they just simply don't have the ability to have other people there with them. So that's really where MedCompanion comes in. And what a MedCompanion is, it is a qualified caring professional who is an extension of a family member, a loved one, a friend, a husband, a wife. That is what the MedCompanion represents. It is someone who virtually is present with you in the room to help guide you and support you throughout your medical visit. And the role that the MedCompanion plays is an important one, in which not only do they support you, they are actively listening, writing anything that the doctor says in terms of your follow-up care, any recommendations. So while the MedCompanion is not transcribing a note or a medical record, they are documenting similarly to that of a friend. So if you've ever brought a friend into your medical appointment, or you've brought your daughter or your mom into your medical appointment, and they're sitting there with a notepad and writing everything and trying to remember everything the doctor said, or what it is you need to do, how many times a day that medication needs to be taken, or what changes in the dosage that medication needs to be, or just in general, anything that they're saying, maybe it's a new diagnosis. The virtual MedCompanion, it is there virtually writing this down, taking notes, creating a summary, creating a checklist for the patient that can then be followed up. It creates a summary of care that lives within our app. So our app is really cool. We partner with Healthy in order to bring forward this amazing app that is HIPAA compliant, that protects the privacy of our patients, which is important to us. And it allows us to create a platform in which all of your summary of cares live. We can keep other documents there that you wish to upload. So anytime you go to the doctor, you have our app, which essentially houses anything you could ever need. So that's a little bit about our service. We will talk in more detail as we continue to talk along here about how it works, a step-by-step process, but hopefully that provides a good overview.
Okay, thank you so much. I had a couple of questions as we went along. You said it creates a summary of the appointment. Is that summary able to be exported or printed? I like to keep a document of absolutely everything I do. So I keep my own records. I just don't want to have to fish around for them when I need them. Would a summary then be printable or electronic that I could save on my computer to compile?
Absolutely. So the summary that we create automatically becomes a PDF record in the app. So within your patient profile in our app, that summary of care is available right after your medical visit. So it lives there. You can download it, you can share it. If you want us to fax it to your primary care or a different type of specialist, we do within our app have a HIPAA compliant electronic fax that we usually utilize to fax the records over on your behalf.
Okay, so those are the things that stick out right away to me. Someone that's on SSI or SSDI, we have to requalify every so often, and they want every single little speck of paper that you can send in. That's why I do save everything. Mm-hmm. So something like this would be helpful in SSDI, and then workers' comp, of course, too, because you would be able to show a gradual progression, or if the patient is digressing, or maybe even just remaining at the same level that they are. I think that is really, really helpful.
Yeah, absolutely. And I would add to that one important thing to note is that our summaries are not considered medical records. So they're in no way, shape, or form replacing the medical record that your physician or your medical provider documents and keeps. Our summaries are just an extension of that. They are a checklist that creates a synopsis of what happened in a very concise manner that is easy for you to go back and look at without having to read through numerous papers. It's very brief, like here are your diagnoses, here's what you have to do for each of them. First, you have to go pick up your prescription, schedule your appointment with your cardiologist, or if you want us to schedule that for you, we can do that. If you need to change your dosage, we write that down. So it's a nice summary and checklist that creates a report that you can use for what you need it to do. So whether it's SSI, SSDI, workman's comp, it just adds to your story, to your history.
I know that when I get a new diagnosis, because inevitably I've got to have more than one. People like me usually end up with more than one. It's always like a kick in the teeth. Like the doctor is like punching me right in the face, and it's so overwhelming to me that even as an advocate myself, I tend to blur out everything else that the doctor may have told me to do. I mean, I might remember that he wanted me to get an MRI or a CT scan because those are big things, but I might forget other things that the doctor has said, such as follow up with PT, or change your diet, or add this supplement, or we are adjusting this dose. So what you're doing is, comparable, I guess, to what a live advocate would do. Sit there Absolutely. And do the same thing, except you're actually creating a full record of it. And I think that is really amazing.
Yes, and it's great that you touched on that, because the feedback from our customers is always in regards to how much they appreciate that summary or how much they appreciate that report. And so one feedback in particular that we recently received from one of our customers after they had gone to the cardiologist was, I sat there and I was processing everything. A lot of the information was new to me. A lot of the acronyms I didn't understand, but I was so overwhelmed that I just didn't ask. I didn't ask for clarification. And they said it was nice afterward when I went into the app and saw the summary of care, that all those acronyms were like spelled out for me. It was nice for me to follow, and it wasn't something crazy. It was like, oh, I think at one point they said like hypertension, and then they went back to HTN. And I'm sitting there like, I've never heard these terms. I have no idea what they mean. And while they were talking to me about a blood pressure cuff, I had no idea what I needed to do or how that pertained to me. But then going through the summary of care and reading like, oh, for your hypertension, which is your elevated blood pressure, here's what the cardiologist wants you to do. And having that outlined for me was like, oh man, this is easy. I can do that. And one of the things that they love too is that our app is not only a place where we store and document these summaries, but it is a place that empowers our customers to really take control of their health, to document it. It has the ability to track your meals, to where you can document your glucose levels, you can document your blood pressure, your bowel movements, whatever it is you need to track for your doctor. It has the ability to do that within our app. And then those are also things that if you needed to go to your next visit, well, we can download your blood pressure log and fax it to your cardiologist or to your primary care before your appointment even happens.
Now, do you actually schedule follow-up appointments, or are you just documenting? So if I need an MRI, are you going to remind me to schedule that MRI, or are you do you handle that too?
Yeah, we do have the ability to handle that. So it really comes down to our customer preference. Some of our customers just like that reminder and like seeing the report that says, hey, you need to schedule your MRI appointment before May 30th or something along those lines. And other customers are like, hey, can you help me schedule this? And here's my insurance information. And we have the ability to store your insurance card within our app as well. So It's easy for us to verify that information and get that scheduled on your behalf.
Even though we've talked before, I'm still learning new things. I didn't know that.
Yeah.
I have a million more questions, but before I go on to them, my next question to you, of course, is what are the team's qualifications? So maybe we should bring in the entire MedCompanion team, and you could introduce each of them, and either you can speak to their qualifications or they can, either way.
Well, I will briefly introduce them and then allow them to give a little background on themselves too. I think it would be nice for them to talk to your community and for your community to get to know them too, because I think they're pretty awesome. But as we started this, I couldn't have done it without the support of my wonderful team and co-founders. So as you will see here, Dr. Brodsky, he does happen to also be my husband. So I am very lucky that I get to work with him on a day-to-day basis. So Dr. Rich Brodsky is the Chief Medical Officer for MedCompanion. And then along with that, we also have Stephanie Suarez. Stephanie is our Chief Operating Officer, and we have CJ Romanelli, who is our Chief Strategy Officer. So together we work on a daily basis and collaborate to make sure that we are streamlining our processes, that we're getting that customer feedback, and that we're constantly improving our service, which is our big mission. We just want to make sure that we are providing value in what we offer. So that is our team. I am happy to formally introduce them. And I'll turn it over to Dr. Brodsky, who can do a brief introduction on himself.
Hi, everybody. My name is Rich Brodsky. I am a board certified physician in pediatrics and pediatric emergency medicine, and I also am an assistant professor of pediatrics. I am, as you heard, married to the CEO, which is a very easy job interview when it comes down to things. And as you saw in that video, I am also a terrible actor. So I appreciate all of your forgiveness in that, as the case may be. Well, my role in this wonderful venture that I was able to start with Marley is to take things from the perspective of the medical encounter, take things from the perspective of the physician and the office visit, and talk about the compliance of the service and making sure that we are HIPAA compliant and making sure that everything is basically medically okay. It's also my job to make sure that our service doesn't overstep its bounds. You know, we have a wonderful service and we want to be there for our patients, and we want to be there for their families and those they care about. But we also want to make sure that we don't overstep and go into a realm that our basically our services are not qualified to do either, because there's been a lot of things that I have seen in my career of blurred lines, people crossing, that we want to make sure that we provide our service and help you get the other services that you need as well. Gracie, there's something that you said that touched something that I felt for a long time now, which is when you were talking to Marley, you said that sometimes when you get a new diagnosis, the only thing that you hear is that, and then a lot of the other stuff gets blurry. Well, that's actually something that they teach you in medical school, is that when you're about to deliver bad news, or when you're actually about to deliver shocking news, you got one sentence to say what you need to say, 1 or 2 sentences, and your patient will hear that thing. That is what they are going to hear. And then you better make sure that whatever you're communicating in that period of time is the most important part. But it is true that after that, you know, things get lost. You know, a lot of things get lost, not because the patient has any issues with their mental capacity, not because they are not smart. They are smart, wonderful people, but you just hit them with something big. And it takes, you know, we all only have so much limited brain power. So I feel like you pointing that out is kind of the perfect example of, you know, what we can provide. And as you said, also our video is, you know, initially had some elder care, you know, tones because of how we started. But I think a lot of our service can be used for people for themselves for that very reason. You know, as a reminder for them. So even if they do not have a family member or a loved one that needs a report on what's going on, a lot of people might just want these records for themselves for that very reason.
Could I respond?
Oh, please. Absolutely.
Okay. So regarding the one sentence that we will hear, it really is the strangest thing from the patient perspective, because I'm really good not only at advocating for myself, but I advocate for other people all over the place all the time. But when it's me actually in that seat and I get a new diagnosis, it's like, I don't know, some fairy sprinkles amnesia dust over my head or something, because I might hear the doctor and be nodding and, yep, I got that. But the minute I walk out, all I can think is, oh my gosh, another diagnosis. Like how much more can I take, or what more do I need? You know, and that's why I think what you're doing is so important, particularly during a pandemic or endemic or whatever they want to call it now. There are people out there with things that people like me should not be catching. So a lot of times we're going to our appointments alone, where previously we would have been taking, you know, Sarah, or Sarah would have been taking me. You know, we would have been taking someone that is knowledgeable about our condition and taking notes for us.
Absolutely.
And Gracie, just to touch a little bit more on that, you know, it's funny because even though we offer this service, we use our own service for that reason, because when we are not working as MedCompanions, we do also take my kids, or, you know, my mom goes to the doctor, or my dad goes to the doctor, or I go to the doctor. But I know Rich and I have had similar experiences. Last year, our son needed to get eye surgery. And I remember going in there, and even though I'm so used to listening and picking things up and advocating and writing things down, I heard surgery. And from a mother perspective, my mind just went like, all I heard was surgery. And then after that, I just blinked. So we were kind of joking, saying like, wow, like we offer this service, but it's different when we are sitting in that patient seat, when we are sitting with our son as the patient and have to listen to the doctor tell us information or tell us he needs surgery, because at that point, we're no longer acting in our healthcare roles. We are listening and acting as a mother or as a father. And that amnesia, kicks in.
Yeah.
It's the same.
Yeah.
Or as a patient, I had shoulder surgery 2 years ago, and I speak this. I'm a physician. I speak the speak. I talk the talk. The doctor was talking to me in the same terms and whatnot. And I remember leaving that appointment and and Marley was actually with me at that point in time, and said, like, "Did he say when I could drive? Did he say when? How long until I?" And so, I am a physician, and yet I still get the fairy dust. It's the same.
Yeah. Yeah. Okay. And that led to even more questions, but I'd like for the rest of the team to introduce themselves, please.
Sorry. I am like most physicians. I don't stop talking unless you interrupt me. So please do. I'm sure you've all had that experience. So please interrupt me whenever I have that problem.
Yeah. So we can move on to Stephanie, our COO.
Hey everyone, my name is Stephanie Suarez. As mentioned earlier, I'm the Chief Operations Officer of MedCompanion. I've got years of experience in the healthcare field on management side, but also on a scribe side, medical scribe side, and a pharmacy technician side. So bringing a lot of experience in that realm, just similar to the rest of the team, and I'm just very excited to join in this conversation. But I'll pass it to CJ.
Thanks, Stephanie, and thanks, Gracie, for having us. My name is CJ Romanelli. I am the Chief Strategy Officer of MedCompanion. I have a similar background in the healthcare environment. I've been working, it's been 10 or 11 years now in the healthcare industry. Started with patient care technician in a local ER, progressed to medical scribe industry, have held a variety of different positions in the healthcare industry since then. But I think just one thing I'll add on what's been commented on so far is, like Marley mentioned, we each have a personal tie with MedCompanion service. And I think it's a service that we all want to utilize, and wish we would have been able to utilize before Marley came up with the idea. I know personally with my grandparents, it's a service that I know would have benefited me and my family. And the rest of my family members as well. But at the end of the day, I think we're all passionate about this, and we want to help people. We have a lot of experience in the healthcare industry, and that's ultimately what we're here to do.
Okay. Sarah, Sarah's my partner. Do you want to say anything, Sarah, right now? You're on mute.
Sharing this with everybody.
I'm sorry, you were on mute for a minute, Sarah. Can you repeat that?
Yeah, I'm Sarah. I'm Gracie's right hand. We've been doing this. I guess I'm on the patient side of everything, and I advocate for others. So it's good to see this service.
Okay. Thank you. Yeah, Sarah and I have been doing educational events since 2014, I think. And sometimes she's both of my hands. So she's selling herself a little bit short there. Okay, now that everybody has introduced themselves, I have some questions. My very first question is, if I use MedCompanion, and for everyone else's information, I have not used it yet. So these are real questions. If I have you, here in my phone, say I have CJ in my phone at my doctor's appointment, is it actually recording my doctor? Because I don't think they would like that.
No. So the MedCompanion virtually appears through our HIPAA compliant app. And we are not recording. We are simply there live to support the patient during their encounter. And that is our goal. So our goal is not to record the encounter. It is not to evaluate or assess the provider or the quality of service. We are there to advocate, to support, and to ask questions. We do, as part of our service, talk to the customer, talk to the patient beforehand, before their appointment, and have a conversation with them and their family if that's what they choose. We ask them what it is they want to get out of that visit, what questions are important to them. And oftentimes it's the family who's like, I can't be there, but I have noticed that this medication is making my mom very dizzy, or she gets nauseous, or she complains that she loses her appetite. And I want to make sure the doctor knows that. So we document that ahead of time. And then at the time of the encounter, when we're present, if those questions don't come up, then we advocate and say, oh, Dr. Smith, the patient's daughter had some concerns with regard to her medication, and here are some things she's noticed. And at that point, the patient will address it. We write it down. We take that back to the patient and their family. So that's ultimately what we're there to do. So nothing is recorded. Oftentimes, providers do feel like having us on video can be uncomfortable. So we just turn off our video and are still there through audio. So that's totally fine. What we want is for everybody to feel comfortable. And if that is how the provider feels comfortable and the patient's okay with that, then we're totally okay with that.
Okay, that touched on one of my questions. What if
And
the
I
doctor,
think Dr. Brodsky
can they
wants to-
see
I
you?
could also say, so, as we were kind of, to your question exactly, as we were kind of developing this, from the physician side, I could automatically see how many doctors would say, absolutely not, if it were being recorded. Physicians would hate to be recorded in that scenario. Medicine is litigious, and they would never permit such a thing. So we would never record. But I want to touch also on the thing that Marley talked about with the video. Our patient's privacy is actually the primary concern over everything. So if the patient requires that we turn off the video, we turn off the video. If the patient actually says, I would like to talk to my doctor about something privately that I do not want on this on the summary, we have to honor that by HIPAA rules and compliance. The patient, their privacy is the most important thing, because it is a sacred trust. We are going into a private physician's encounter, or nurse practitioner, or I want to just use physician, but there are lots of different services. So for whatever reason, let's say the patient wants to discuss something that they don't want getting back to their family member. They say, I'm sorry, MedCompanion, whatever this next topic, you can stay on the line, but this next topic needs to be left out of the record, for my, I do not want my family to have it.
That's good.
And that is our utmost duty, is to provide the service for the patient, but also to keep their trust as well.
Okay. And usually what would happen in that situation? So for example, let's say a family member was diagnosed with cancer and they didn't want their relative or loved one to find out from a report, right? We would still write down the information. It would live in our record only. But if the patient says, like, please make sure that it is removed from the report that is visible to my loved ones or to my family, we have the ability to hide that information. So per their requests, we will only share what they feel comfortable with us sharing. Maybe they want to give that diagnosis in person. Maybe they want to gather their family and have a more private conversation about it. And we respect that. So even though we are fully present, if there is something that was said that the patient changed their mind at the last minute, or they're like, I don't want my daughter to know that, I don't want my son to know that yet, we will not disclose it on the report.
Okay. Since we've switched over to Dr. Brodsky a little bit, that led me into another question. And I know you said you like to talk. What happens if I take MedCompanion into my doctor's appointment and I explain that it's not recording, it's literally just a virtual advocate there for me, and my doctor still doesn't like it? From a physician's perspective, what would convince you?
What would convince me? Well, just so you know, part of the process of onboarding for MedCompanion is that we will call the physician's office ahead of time and let them know that we will be there, and kind of explain the service to the office staff a little bit, and invite the physician or whoever's there to call us with questions if that becomes an issue. So in theory, they should be prepped that this kind of a thing is going on. So from a physician's standpoint, I can say, what would a physician gain from my patient having this kind of service? If the something that you could say is, I sometimes can't remember everything that you talk about in this. I can't remember in this encounter. I'll get a few things, but I won't necessarily follow your directions because I can't remember them, or I want to make sure that I follow them exactly, or I don't want to make a mistake. And for that reason, I invited other people to come with me, but either because of your policies or because they were busy or because no one could be here with me right now, which is why I have this service. They are here to help me understand what you are going to tell me. They're going to help me. It is not recorded. It is not a medical record. It cannot be used in any way except for my benefit. And frankly, I really need it. So if you don't want me to have it, I'm sorry. I really need it, and it's going to help me follow your directions. Because let me tell you, the one things that physicians, get a little on edge about is when they tell a patient to do something and then it doesn't happen, and they get all annoyed, and then they're all huffy about it. Doctors get huffy about lots of stuff, and then it almost becomes an antagonistic relationship. And I know that doctors don't want to have an antagonistic relationship with their patients. I know patients don't want it. They don't want to have to go back to the doctor and say, I didn't follow your directions. I'm sorry. They know they're going to get a talking to. So I think when you play on that, not play on it, but advocate for that type of relationship, that you want to build a relationship with them, and this is going to help you do that, I think that would help convince them.
Okay. So, in essence, it should help the doctor too, right? Because it would make your orders more effective if the patient were following them.
Another thing as well is that a lot of times physicians will get calls from patients' family members after the encounter and say, oh yeah, my sister said she's fine and nothing's going on. What really happened? And then the doctor's in a position because they're like, well, I can't talk to you without your sister's permission. I can't. Then there's an antagonistic relationship there. And the doctor probably doesn't have a lot of time to just be on the phone with everybody's, relatives as well. It saves them time, for the encounter. Just say like, listen, all of my family members are going to get this report afterwards, so they won't call you with questions. And that will probably help them as well.
Yeah. That's an excellent point.
And I can add to that from having been the person that sometimes calls the offices, if it is an office that we haven't provided a MedCompanion before, we do call ahead. Normally it's a few days beforehand, and then again on the day of the encounter. So if they're going in for a visit today in the afternoon or in the morning, we try to call either the night before or the day of. We also send them or fax them an informational brochure that outlines everything about our service, both from the patient and physician standpoint. So we do have those resources available. The feedback has been pretty positive. Most of the time, they're very welcoming. In the event that the physician refuses for whatever reason, then at that point we can refund or, keep that credit towards another visit if that was something they wish to do. We are still pretty new, so sometimes it is a matter of the physicians understanding the service and getting used to it. But as we've been around a little bit longer now, I think physicians are starting to understand. Their staff members are starting to understand what we offer, what we provide. And recently we booked a service for a customer who had to go see a cardiologist for the first time. And I called the office. The staff members were like, okay, great. Can you give me the name of the urgent care? Can you give me the name where they were seen? We need to request their paperwork. We need to do this. And they had this long to-do list. And it was nice for me to say, like, you know what? I actually have all of those papers for you. If you give me a fax number, I can send it to you and you'll have it right now. So they were like, oh my goodness, you do that? You just saved me so much time. So from a staff member standpoint, that is also a time saver for them too. From a physician standpoint, I know that the cardiologist was appreciative that we were in the room because I know oftentimes, especially men, can downplay their situation. Oh, it wasn't that bad. It was just a little chest pain. um, so having that and having like the questions from the wife or the questions from the mom who's more concerned and be like, this is what happened. This is what the mom is concerned about. I know the cardiologist was like, you were not telling me the full story. So it was nice to have that interaction. So I think so far our experience for the most part has been pretty positive, pretty receptive. We hope that it continues to go that way as more and more clinics understand our service and become familiar with our service.
Okay. I like the collaboration of care, because people in our community, we don't have a GP and a specialist. We have a GP and 10 specialists. Mm-hmm. And so we're constantly taking, I'll make 10 not literally 10, but a lot. I'll make this many copies of the exact same report and take it, to each one of them to make sure that everybody's on the same page. So if we had, if we utilize something like this, it would help facilitate the collaboration of care. I really like that. But it does lead me to my question, and any one of you can, well, first of all, who's actually going to be in the phone? I assume it's not Dr. Brodsky because he's too busy. Would it be the other three of you?
It would be either of us or one of our employees, one of our other MedCompanions.
So here's a really big question for my community is that, we're not going in with strep throat or pink eye or a broken arm. We have chronic, debilitating, incurable conditions. And I have to assume that all of you are not fully versed in all of those things. Well, none of us are fully versed in all of those things. So what I would like to know is, do you, would you meet with me or have some kind of a Zoom or a session or something so that I can explain to you not only what my diagnosis is, but like what that is and what that does to my body, and, I guess teach you, or are you aware, or, we all have special conditions that are typically falling into the cracks of improbability. We're very rare. And what I'm wondering is, how do you handle those situations?
Yeah,
I'll let Stephanie answer that, because it does fall a little bit into our education and into kind of like the initial parts of our process.
Yes. So to start that question off, I think it's easy to just talk about like the process. So if you were a client signing up for a MedCompanion, the first thing that would happen is you would actually have a phone call with one of our care quality specialists. So we do have two people that you would actually meet with. The first one is going to be your care quality specialist. During that first initial call, you're actually going to talk about your needs. Marley kind of touched on this earlier, that everybody's going to be different. Some people want it because they want to send a report to their family members. Some people just want it for themselves. Some people want it because they see 10 different specialists. That's what you're going to talk about during that conversation, that initial conversation. And that usually happens, I would say, at least a week before your appointment. And you're at that point, that's when the patient or client, whomever, can address any questions, concerns. They can talk about their history, and our care quality specialist is actually putting that into the Healthy app internally, so that anyone that the MedCompanion that does go to the visit with the client will see all of that and has a chance beforehand to brush up on their history, everything that they need to know, and be prepared to ask those questions, basically. And from an operational education perspective, it's fair to say that, one of the biggest things with healthcare is that we're continuously learning. And that's something we do internally with ourselves, and something we do internally with our employees, is continuously teaching them, trying to brush up on everything that we know. And I apologize for my dog. Brush up on everything. There's always new stuff going on in the healthcare field. So that's one of our biggest things, is like we're continuously learning on the back end. And as things come up, we're teaching and growing from it.
Okay, so Stephanie, if if I happen to get CJ in my phone, right, as my med companion, and CJ randomly or whatever has now been with me at 3 different appointments, and it's with 3 different specialists, he's now becoming familiar with me, my unique needs. Is there a way to request someone, like he knows so much about my condition now, I don't really want to start over with another one. Could I continue care with this one?
Yeah. Within Healthy, you can actually choose who your med companion is. So when you sign up again for the service, you can choose a med companion, whether it's a previous one, or if you weren't too happy with your med companion, you can always choose another one. Or if you just don't care, you can let it pick randomly as well. Yeah.
Oh, that's super cool. That's right in the app.
Yes.
Yes.
So you can tell I don't have the app, or I would have known that.
We could also, as we start to see which customers like working with certain med companions, we can create like a portfolio or a group for that med companion. So that way, when you go and sign up, you can sign up with CJ, and it just is easier. Like you would constantly get CJ. CJ is anticipating you booking with him.
Okay.
So we do have the ability to control that, and if that's something that you want, we are able to provide that for you, that continuity of a med companion to the best of our ability.
Very cool.
I would comment though as well though that CJ is a very charismatic individual, and he's very much in demand, as you might imagine, as probably the best med companions might be. So we would probably ask that, if you do fall in love with CJ, as many of us have, that if he happens to be booked with a different client as it comes to the time of your visit, he might have another client that also has requested him ahead of time. We just ask that you be patient with us and maybe give another med companion a try at that point in time, because we will, we are expanding. We will have, more med companions as we grow to choose from, and as things happen in life, sometimes med companions will leave us to take on different careers and whatnot. So there may become a time that you might not have the exact same med companion for everything.
Sure.
But to the best of our ability, we will obviously try to honor your preferences.
Well, I picked on CJ because he hasn't spoken much. So I have just a couple more questions, but I want to remind everybody that's watching that if you have a question and you would like us to present it anonymously, please email Sarah. It's at the bottom of the screen right now, sarahggpayne@gmail.com. I have a couple more questions. So, of course, as you talk, I'm relating all this to myself. And, my situation is not the same as everyone's, but you can't help but think about your own scenarios as you guys are talking. So, I guess, I don't know if it's a question or comment, but one thing I wanted to touch on is adult children or late teen children. I know that once my kids turned like 16, they didn't really want to hang out with me anymore. They sure as heck didn't want me going to their doctor's appointments. So I think that this service, in our community, we have a lot of parents that have late teen, young adult, children with these conditions. And this service seems like it would be nice for the moms of the world to be informed without, the children being irritated that their moms are going, I guess. I guess that's what I'm trying to say. And then also, this was geared toward elder care, but this also hits home for me because my mother has stage 4 lung and brain cancer, and she doesn't really have the capacity to remember what's happening or what the doctor said to her. If she goes to an appointment alone, she doesn't really remember. So this would be really handy for her, just tap a button or whatever it is, and then there'd be a report, and hopefully I would get access to it. I guess that's a good question is, how do you, in your pre-interview, is that how you determine who the patient wants to have access to their records? Yes, everybody's nodding yes. And then you email that out to them?
I'll let CJ answer that.
Okay. Yeah, through our intake process, I was going to add when Stephanie was commenting on it, we do have a variety of different intake forms when we learn about the patient. the family members the questions they want to ask and any diagnoses and background that they want us to be aware of through that intake flow process. When we have those forms, when we have you complete those forms, that's the time where we gather that information of which families would like access to the materials. And that's where we have the consent forms that we can have you fill out through the app.
Okay. So if there were 4 kids, you'd be able to release that to all 4 people.
If the patient consented to that and went through that process with us, that they wish those 4 people, yes.
Okay.
Yeah, and what ends up happening is that we can add like caregivers underneath each patient profile. So as long as we have the patient consent as to who they wish to share information with or who they wish to have access to their profile within our app, we can add those caregivers and they would each have their individual logins to just log in and see the information.
Okay, awesome. So a lot of people, even adults, have a caretaker, whether it be their spouse or their best friend or their next door neighbor. You know, they have an actual caretaker that would need access to that information.
Absolutely.
Go ahead, Marley.
Oh, I was just going to say, speaking of young adults, Gracie, since you touched on that too, one of the other things and benefits that our service provides is helping these young adults understand and navigate their care as they are taking that on probably for the first time. Uh, and just having the ability to have us there if their parents book it, if they book it on their own. We have the ability to just help coordinate those calls, schedule them on their behalf, keep that record for them, and the parents would have access. But it's also nice as a young adult to feel that independence and empowerment, like, hey, I can take control of my health. I can have somebody
Right.
book my appointment. I understand what my health means. I understand what I need to do. I can record my meals. I can be actively working on some of my fitness goals and document them within our app, which also syncs to several different apps. So it does sync to like Apple, your Apple Watch, your Fitbits, and a few others. So if you have like a Fitbit and you sync it to the app, it actually transfers all of that information directly into our app as well.
So the app knows how many steps I took that day and what my heart rate was all day, etc.
Correct. Yes.
Oh, nice. Okay.
Gracie, I think that to your question as well, the point is brought up of who is the person who actually contacted us for MedCompanion. Sometimes that is the patient saying that I know that I have this issue that I want to share with my family, but sometimes it is the family. The family sometimes calls us and says, like, I have a sister who's about to go to an appointment, and I want to make sure that she usually brings me to the appointment, but I can't be there this time. So I want to make sure that I'm still in the loop. At that time, we will still contact the patient and make sure that they are okay with it. Like everything, again, is patient privacy centric. But there are people who want to use us for their family member. And as you spoke to in the beginning, that does fit into elder care, but it also fits into sister care, into adult child who's in college across the country care, into
Right.
all of these different types of care. So sometimes our client is the patient, but sometimes the client is the family member who we have to make sure that the patient is okay with us sharing that information with.
Sure, that makes sense. That was my next question. What about other family members? So it looks like we have 6 minutes left. So I want to ask, since this appears to be so beneficial for the doctor, for the patient, for workers' comp, for SSDI, does insurance cover your costs?
Not yet.
Not yet.
That's
Not yet.
That's what
Okay.
we'd like to say.
But you're working on it?
What we're at the stage of right now is proving how beneficial it is to our patient population. And once we have definitive, like, hey, look, we know it provides a benefit. Our customers knows that it provides a benefit. But once we have that benefit that can show the insurance companies that financially it would behoove them to pay for our services, we will then be performing a significant amount of advocacy to get to be covered by Medicare, Medicaid, and insurance companies.
Sure. Okay.
And that financial benefit will probably come from the fact that patients will get better care when their family members know what's going on, know what diets they should be taking, know when their next appointment should be, know how to take care of them. The patients will get better care and they will be healthier. And if they're healthier, the insurance companies have to spend less money. So then they would cover us at that point. So that's everything for them comes down to dollars and cents.
Yes, of course. We know that pretty well. So then what is the cost of the service?
Yeah, so because of the different stages and the extensive process that we go to make sure that our patients or our customers are well taken care of, that we understand what they need and we can coordinate everything, the cost, a single service cost is $49.99. And that covers their initial intake, the conversation with us to make sure that we get to know them, that we can keep a record, that we've complete all of the disclosures and patient release forms for who they want to share this information. It's a pretty extensive process. It also covers the MedCompanion visit. So the $49.99 includes the MedCompanion visit and any sort of scheduling after the fact. So if you need to schedule specialist visits, if you need to schedule some sort of x-ray radiology, we can do that on your behalf. So it does include that. And we also have a subscription plan. So the subscription plan seems to be a favorite so far. So usually that is $119.99 for 3 months. So that includes, similar to our single service, everything that I just mentioned, but 3 times. So, every single time they go, basically 3 visits. So every time they go to the doctor, they'll get their care quality specialist call to review everything, make sure we understand what they want to get out of that visit, make sure we have all the questions they want answered, all the information they want addressed, and then the MedCompanion call, with any follow-up. And there you can see them. And then also a new package that we haven't released yet, but we are going to be releasing in the near future, and we're sharing today for the first time with your community, is our booking service. So what the booking service entails is for anyone who's gone to, let's say, an emergency room visit or an urgent care visit, and they walk out of there with a diagnosis or a follow-up like, hey, go to a cardiologist or go find an endocrinologist. What we have been testing out and has proven to be pretty successful based on the feedback has been our booking service. And what that means is if you're walking out of the emergency room because you were seen for chest pain or you have a heart condition suddenly that needs to be followed up with a cardiologist, most people don't know where to start or who to contact or where to go. So what we do is our MedCompanions and our care quality specialists do the research for you. We look at some of the services and specialists in the area. We make sure that they take your insurance. We also call them personally. So we, in our pilot that we recently completed, we called a few specialties where we didn't get a call back. So in our heads, it's like, why do we want to put our customer through that? Right. Mm-hmm. So if we can't even get a call back, like, I'm not going to book an appointment for our customer because, our customer is going to have trouble later if they're not using us. So we want to make sure that when we're booking the service, not only are they taking your insurance, they have good ratings, but that you're actually going to get that quality care from that specialty clinic as well. Okay. So that's something that we are going to be releasing soon. It's not active yet. It's not in our packages as of right now, but we wanted to share that because it is something we're excited to start on in the near future. It's something that we piloted recently, and the feedback has just been incredible in terms of time saving and just not having to stress about where to go or how do I even find the right cardiologist. If you have an idea, we can look into certain area or certain specialties or certain providers. But if you don't, we can do the research for you. So.
Sure. Okay. I did have a question about your subscription package. You said $119.99 for 3 months. Is that only 3 visits, or is that all my visits in the 3 months?
It's 3 visits per month. It's $119 per month for 3 months, and it's 3 visits per month. And then if you need an additional one in addition to that, what was the additional add-on price? I'm sorry, I'm not the best with the packages.
Yeah, so it's $119.99 per month for the 3 visits per month.
Okay.
And if you needed an additional service, and you can add on an additional MedCompanion service at a discounted rate of $29.99 instead of like the $49.99.
Okay. So if that were me and I did a subscription of $119.99 for 3 months, I get 3 visits per month. I'm going to pick my 3 doctors that are the most important to me.
Okay.
You know what I mean? Like I wouldn't,
Yeah.
no offense, Dr. Brodsky, but I'm probably not going to choose the GP. You know, maybe the neurologist, the pain management specialist, and I don't know, another one.
I'm not offended. I'm not a GP. I'm with you.
Oh, I'm sorry. Yeah, right. You're a pediatric specialist, right?
Pediatric ER. Yes.
Pediatric ER. Okay, great. So I didn't offend anybody.
Not at all.
Except a GP that might be watching. But hey, some people, maybe they only have 1 or 2 doctors, and you know, that would be part of it.
Yeah.
And one thing that I wanted to add as well as while Marley was talking about everything is that once you do sign up, you get the Healthy app for free, and get to utilize that. So if you sign up once and it's just a regular 1 time per year visit, you get to still use the Healthy app that tracks everything that you need. So whether it is blood pressure stuff, you know, your fitness goals, things like that, that comes free of charge, and you always have access to it.
It stays there forever?
Yes, you have lifetime access to our app.
Oh, cool. Okay. Okay, we are at 1 hour and 2 minutes. So I want to ask Sarah quick if you have any questions emailed to you.
No questions.
Okay, and did you have any questions specific for the team here?
I don't. They were all answered.
Okay. Okay. Well, everybody that's watching these videos, whatever platform you happen to be watching this on, this video will live there. It will remain there. So you can go, and it'll also be on our websites. So you can go to medcompanion.com, you can go to their Facebook page, you can go to their YouTube, and the videos will be there. And of course, it'll be all over. Sarah and I will also have it all over our social media. So if you just jumped on in the last 2 minutes and thought, oh man, I wish I had seen all of that, you're absolutely going to have a chance to watch it over and over and over again if you want. So I'd like to thank everybody for joining us tonight, and especially our MedCompanion team and my right hand and sometimes my left, Sarah. This has been really informational. Like I said, even though I had already met with Marley once, I met with the whole team once, I still learned a lot tonight. You know, there were things that I didn't think to ask before that you preemptively answered. So this has been really, really informative, and I really appreciate you guys taking the time to help educate our community, because, you know, we need all the help we can get.
Absolutely. Thank you, Gracie, so much for inviting us and allowing us to be a part of your community, and hopefully we will be able to service your community as well.
Yeah. Okay. So if anybody has any questions, how do they reach out to you guys?
Yeah. So if anybody has any questions, you can email us at hello@medcompanion.com.
Okay. hello@medcompanion.com.
Yes.
Okay. Well, I think that we will wrap it up now. Thank you, everyone, for your time. I think we have a brief little, oh, there we go. Email hello@medcompanion.com. I think we have a brief little summary here for you, and thank you very much.
Thank you.
Thank you.
Thank you, guys.